but it's not to every family who can't. And how do we work this so that if you're an 8-year-old kid with rheumatoid arthritis, you don't wind up in a wheelchair at 21 simply because you couldn't get that prescription. And that's what we're trying to work on. In the white coat.
Thank you.
Come on down.
I'm retired from the Navy, and I have very good health care, TRICARE. I don't know how many of you are familiar with it. I have 2 points. One is the promise that President Obama made that I won't lose what I have when he was upheld. And secondly, will all the members of Congress share in the same health care plan?
First thing is in regards to your care that you have. Nothing will be touched on that. I think if you've seen anything, you've seen the care get better. In the veterans area, we had the highest funding for veterans care in history this past year. And hang on, guys. And for our region, in the year 2012, because it's the first budget year, if you get it done now, that you can get into, is in the year 2012, in the South Bend region, just an hour away from here or 45 minutes away from here, we will be opening a 70,000 square foot clinic that will have all the things that you go to Fort Wayne or Chicago for now will be in South Bend. And in addition, as a veteran, for inpatient care, St. Joe Med Center and Memorial have both agreed they will compete on different parts of the inpatient care. So maybe if you have a knee operation, you go to St. Joe. If you have a heart condition, you go to Memorial. And what we're trying to avoid is folks getting on the highway in the middle of the winter. The driving is being done by volunteers, where you have a 70-year-old guy who's good enough to do it driving 3 80-year-old guys, and you have the first appointment early in the morning, the last one late at night, and everybody has to wait the same. So we're trying to make sure we honor that guarantee. As to Congress people having the same insurance, first I just want to mention that I do not have government insurance, never have. We've had a family plan for years and years, and I pay my premiums every month on my family plan and keep that. Second is, just so you know, when you hear or see in different sources on news or on the web or whatever that Congress people have special insurance, the insurance that's offered to members of Congress is the same insurance that's offered to members of the Capitol Police, the same insurance that's offered to the folks who are cooking the eggs down in the morning in the cafeteria of the building. It's the federal health insurance fund. And so it's the same as everybody else. And I presume that if a public option goes through, that portion of it will initially be for uninsured and for small businesses who can't afford the insurance, but certainly Congress people should be treated the same as everybody else. And in the federal health plans right now, that's what's already happening. I'm trying to go around and get around. And sir, over here.
I'd like to commend our audience for such responsible behavior.
Me too. It's been great.
Thank you all. This is not going to be a consensus debate like we've seen, but I've
been working out just in case.
Right. They're doing great, and I hope it goes that way to the end. But I generally try to simplify complex problems. And the way I've seen it, debate in Congress before we went on recess and we really have two areas of thought, schools of thought. One that supports President Obama's initiative to fix basically a seventh or maybe a sixth of the economy. And the other body of thought which says don't touch the free market, don't change anything, and please leave it to another day and another time. And none of us have to vote on this, but you do. Eventually, after the House finalizes its version, because I believe they will, and the Senate finalizes, when they come together in conference, for
That's correct.
You have to reconcile the differences. And
That's right.
Re-vote on the final version. This is going to be decision time before that.
That is true.
Now,
Perhaps even my wife won't be living with me at that point, but...
Earlier you mentioned that this afternoon you're going to go to church. I wonder if in considering your vote, what do you think
Well, I have not been fortunate enough that he's spoken to me. However, I am a person of faith, and I try to keep that in mind. And the other thing that I try to keep in mind besides that is this. I've been blessed because I've heard from a lot of folks on a lot of sides of this issue. And it comes down to what is the best for the people of this country and for the long-term future of this country. And that's how this decision is going to be made, is when I look at my kids and my grandkids, have we made this a better country, and has it become a better place for the people who live here, and do we have a better long-term future, both individually, health-wise, and financially? And so that's the decision that's going to be made. If the good Lord will talk to me this afternoon, I'll be more than willing to listen to him. So that would be of enormous help. Okay. Well, I'll try to repeat the question. That's my failing. Yes, ma'am.
Yes, I hear a lot of talk about how we're going to help
I'll repeat
people.
it to everybody out there.
I hear a lot of talk about how we're going to help people who are already ill. And I know that we have well baby care, and then we have lots of care to take care of people after they're ill. But what is going on for the in-between time, for the middle-aged person who is well already, who maybe, doesn't go to the doctor until they are sick? Is there going to be any well benefits?
Okay. What was asked is, are there going to be any wellness programs in this, any wellness benefits as part of this as well? And that is something that there's actually one of the 6 bills that's out there is called the Wyden Bennett Bill. And one of their primary focuses is wellness care, where we have skin in the game, where on our policy that we have, whoever has that policy with us, that if we meet certain health tests, if we meet certain things, that premiums then go down, that we go in for a checkup every year if we want to, and when we do, if things look good, that our rates go down. Much of what we find in our country right now in terms of medical costs and the high amount of funds being used for medical costs is wellness care and wellness prevention. I could stand to lose a few pounds. A few other people might be able to lose a few pounds. But if we do these things, our heart rates get better, our cholesterol goes down, all of those things, we save money, and as a country we get stronger. So I truly think that anything that gets finished will include wellness care and wellness programs as part of this moving forward. Sir?
Tort reform. I never hear it talked about tort reform.
Okay, tort reform. That would be attorneys. And you never hear it talked about, but I will tell you that my guess is that has to be part of anything as well. I met with a group of attorneys about a week ago, and in talking to them, told them the thing with this program is everybody takes their turn in the dunk tank, is how you get somewhere. If everybody sacrifices a little bit, we can actually move the ball forward. And so it is in discussion. Yes, sir.